A city that never sleeps, reawakening. Mayor Bill de Blasio saying today that New York City will be 100% open on July 1st, thanks to rising vaccinations. Let's bring in Harvard Medical School physician Dr. Aditi Nerurkar. Dr. Nerurkar, how do you feel about this July 1st timeline for New York City? Is it appropriate or too ambitious?
You know, I'm hopeful that July 1st works. I am cautiously optimistic. Right now, when we look at all of the boroughs in New York, we have vaccination rates ranging from 25% to 40%. So we do need to do a better job in vaccinating more New Yorkers. But if we are to meet the goal, it would be very symbolic because New York City was the epicenter of the early pandemic, and it would show a sense of resilience for the city. So given that we can vaccinate more New Yorkers, we may be able to meet that goal. I just want to keep in mind that we want to be cautiously optimistic since we have had setbacks in the past.
So let's talk about vaccination rates, not just in New York, but across the country. More than 99 million Americans are fully vaccinated, but our vaccination rates in the U.S. are slowing down. So how do you even begin getting back to normal in places where vaccination rates remain low and they're just not quite budging?
That's a great question, Allison, and it's something that many of us are talking about. We've had a drop in about 12% over the past few weeks in vaccination rates. We have 30% of U.S. adults fully vaccinated and about 45% of U.S. adults with at least one vaccine. That this is the next phase of vaccine rollout called vaccine equity. We have to work hard to remove barriers, economic, geographical, racial, religious. We need to make more vaccine more available to more people and make it as easy as possible for people to obtain the vaccine. That's the next step.
We're getting more real-world data on the Pfizer and the Moderna vaccines. Fully vaccinated seniors are 94% less likely to be hospitalized with COVID-19, according to the CDC. If that isn't incentive to get a vaccine, I don't know what is. What other data are we seeing that you think makes the strongest argument for getting one of these shots? Because we know there are still people who aren't sure if they're going to or maybe are afraid to.
That's a wonderful way to phrase it, Allison. You know, this CDC study is a real world example of vaccine efficacy. We know that there are three goals to the vaccine. The first is to prevent severe illness. The second is to prevent hospitalizations. And the third is to prevent death. This study has shown us that there is a 94% reduction in hospitalizations, especially for a high risk group. And you said it best. If this doesn't convince people that the vaccine is efficacious and helpful, then I'm not sure what else will.
Yeah, if the goal is to stay alive, stay out of the hospital, it certainly sounds like those two shots achieve that. Dr. Nerurkar, we talk so much about what's going on here in the U.S. because we are here in the U.S., but we have to talk about India. The country is doing mass cremations after what is being described as a tidal wave of COVID deaths. There are concerns that even the numbers we're hearing are underreported and that it could be even worse. What is the risk globally from the outbreak we're seeing in India right now?
You know, the Indian COVID crisis is a humanitarian disaster of epic proportions. It's dwarfed anything we've seen prior, and it hits records for COVID deaths, COVID cases, test positivity rates. They're seeing shortages of oxygen, of hospital beds. You know, this has global implications for first, just containment. We know that the virus does not respect national borders. So the fact that there is this second surge, unlike anything we've seen before in India, will have downstream implications for the world. It also impacts global reopening strategy, different countries figuring out when and how to open and whether this surge in India will impact them. And finally, it could have an impact on vaccine supply chain. You know, data has shown that about 10% of Indians are vaccinated right now. But in spite of the fact that India is one of the largest manufacturers of vaccines worldwide. So this is, of course, going to impact us in one way, shape, or form. And we really do need a coordinated global effort to help India at this time.
Dr. Nerurkar, it's always great to have you on. Thank you for all the medical advice and just the reminders for us that what's happening with COVID around the world, we need to pay attention. It's really important to us at home, here at home in the U.S. as well. Thank you.
Thanks, Allison. Always a pleasure to be here.